How we think and feel about our lives and ourselves have an impact on our behavior and how we cope in tough times. Mental health disorder threatens the quality of our well-being and is a severe threat to our quality of life. Given that she runs a disability program already, the Cameroon Baptist Convention Health Services in 2015 created the Community Mental Health Services called the Family Care Center based in Bansok Baptist Hospital with the purpose of improving quality services at all levels, base hospital and outreach, which has so far treated over 10,000 patients with mental illness.
There are more than 300 different types of mental illnesses. One of them is schizophrenia, and these people, we may see them on the streets, they may be hearing voices that people don't hear, they may be having beliefs that they are supernatural, or they may be seeing strange things that other people don't see. Bipolar disorder. In bipolar disorder, we have patients who are either depressed at one moment or having mania at the other moment. So it's called the two poles. In one of the poles, in the depressive pole, the patient is extremely quiet, very calm, withdrawn, doesn't want to talk to anyone, is not interested in anything, doesn't want to eat, always sleeping or not sleeping at all, and so on. And on the other side, when the person is having mania, he can be very, very excited, very energetic, always troublesome. We equally treat epilepsy, where people have repeated convulsions, more than one convulsions in 1 year. Convulsions is not just about falling on the ground and foaming, but we have things like daydreaming, we have things like abnormal behaviors that come for very short seconds are convulsions, and there are very different types of convulsions that can occur. We also have problems like children who don't grow normally, children who are delivered through difficult deliveries, and so their development is not normal. They don't speak when they're expected to speak, or they don't walk when children are expected to walk. They don't perform well in school, they have intellectual problems. All of these are called developmental problems. And then we also have elderly people that can start forgetting when they reach around the age of 60 and above.
The coming of these services has been celebrated by the beneficiaries.
I worked with Brothers in 1977, but for 1 year. I was transferred to Bansok. I worked there for 10 years as a magazine. Then I was posted to come back to go and open Brothers Day in 1986. So when I went there, I was the first key storekeeper accountant in the magazine. I stayed there for three years.
Killian had been very withdrawn because of some problems he had had in life, some challenges he had. So he developed depression, as we saw the first time. He was very withdrawn, he was not talking to anybody, he didn't want anything in life, he didn't want to interact with anyone, he even refused to eat sometimes. So when we saw him, we diagnosed him initially of depression because there were no episodes of mania. And we started giving him antidepressants. That was amitriptyline. So when we gave antidepressant, because his actual diagnosis was bipolar and he was just having the depressive phase, he switched on to the manic phase.
For his part, for Julius, after 14 years of mental illness, has now reunited with his family since he started treatment.
One woman gave Julius 8,000 francs, which she had borrowed from an unknown source. Few months later, Julius took ill and requested that the money be refunded back to the woman. I gave him the money to give her, and he did, but became mentally ill afterwards. His father and I started going from one traditional doctor to the other for treatment to no avail. This went on for about 14 years when we got into contact with the mental health nurse from Banso Baptist Hospital, who consulted him and gave some drugs.
We saw Julius sometime last year around October. He was really looking shabby, dirty. He was eating from garbage, picking things, wearing rags, and after assessment, we diagnosed that he had schizophrenia. So we started treating him with antipsychotic medication.
Phi Emma is one of those who believe that her mental illness was as a result of witchcraft.
Somebody brought me firewood one day which I used for cooking. Few hours later, I lost my memories. Before then, my husband had abandoned me for another woman, and I had lost my child. When I lost my memory few months later, I started going to BBH chapel every morning for prayers. It is then that I got in contact with the mental health department and started receiving my treatment.
The story is different for Wambung Basil, who suffered from drug abuse.
Basil has been taking marijuana for a very long time, and it had gone to the level that he was roaming the streets around Fundong. He was naked, he was on the streets, he had grown hair, he was tied up and brought here for treatment because they had really moved from one hospital to the other, but he could not be treated. His family had almost even given up on him. You know, when someone is taking drugs like marijuana, that person is considered to be stubborn or recalcitrant, or the person doesn't like himself. And telling the person over and over to stop, the person cannot stop. So the family saw him like someone who didn't want to help himself. It became very challenging. They brought him here. We admitted him for some time, for like 2 weeks, and treated him, and he became well.
An effective treatment of mental health disorder should include the reinsertion of the patients into the society. This only happens when a friendly environment is created by their family members, friends, and the community at large to do their own things.
I just had to put him now on my plot that you are the caretaker. Anything that is taking place in my plot or this structure I'm constructing is still your own. Be there.
He assists me in fetching water, splitting firewood, and sweeping the surrounding.
All hands must be put on deck to ensure that sensitization, identification, and referrals is done.
So many of them that we are with mental illnesses in Donga Mantum that we have identified. We have started a treatment.
Despite the success rate, much still needs to be done.
When we get the expensive ones, if we even manage to have them, many patients cannot afford. So if the government could assist in getting these drugs and subsidizing them for the patients, it will really go a long way to help patients.
With the results they achieve in the level of their treatment, the patients leave the family care center each time with smiles and appreciations.